Hello everyone. Today we will be discussing various data collection techniques used by researchers in behavioral and social sciences. We will briefly look at observation, case studies, and questionnaires as effective tools of collecting data. In observational research, behavior or other phenomena are systematically observed and immediately recorded by the researcher as the behavior occurs. The goal of the researcher in observation is to describe a variable or a collection of variables of interest. It is generally a non-experimental method because nothing is usually manipulated or controlled, as the observation is based on real life events, what is occurring in its natural environment. It could involve both qualitative and quantitative methods, and of course their combinations resulting in mixed methods of research. There are four main types of observational studies: naturalistic, participant, structured, and unstructured. Let us now explore the features of each of these types of observations. In naturalistic observations, behavior and phenomena are recorded in the environment in which they naturally occur. This kind of research is also called field research. There are two kinds of naturalistic observations. One is where participants aren't aware that they are being observed. That is called disguised naturalistic observations. And when it isn't possible to withhold the identity of the researcher, where it is unethical or impractical to do so, undisguised naturalistic observations are pursued, wherein the participants are made aware of the fact that the researcher is present and that he or she is monitoring their behavior. An example of naturalistic observation is Dr. Jane Goodall spending 3 decades observing chimpanzees in their natural environment in Africa. For example, if researchers decided to inspect behaviors of individuals in schools, stores, or in other common public areas, this would be considered a naturalistic observation. For psychologists who are aware of Bober experiments conducted by Albert Bandura, these weren't naturalistic observations, as the environment in which the behavior was being recorded was simulated, and in other words, it was conducted in a laboratory. The second kind of observation is participant observation. As this image indicates, in participant observation, the researcher becomes part of the group that is being observed, whereas in non-participant observation, the researcher remains away from the group and observes the group from a distance. The researcher has to either immerse him or herself in the setting, depending on whether it is a participant observation or a non-participant observation. And both of these could be disguised or undisguised. In a classic disguised participant observation, Rosenhan and his team disguised themselves as patients and were admitted to several psychiatric hospitals so that they could observe how the staff behaved with the patients. None of the staff nor the other patients were aware of their true identity, which allowed Rosenhan and his team to collect accurate empirical data on the real-life occurrences within the hospital setups. Structured observation now is more systematic. Data is collected according to a predefined schedule. Specific variables or behaviors in that particular setting are observed in a predetermined fashion. The setting can be either created as such in a laboratory or it could be a natural setting. Unstructured observation is where researchers do not decide what they are going to observe. Rather, they rely on the natural events and then record what is being observed without having a predefined set of observational rules. In structured observations, researchers have a predefined set of behaviors or variables that they are interested to study. Usually, quantitative data is collected in structured observations. A process of coding is used and analyze the data. Coding will generally involve defining clearly target behaviors that are to be observed and recorded. Observers will then categorize participants individually in terms of which behaviors they have engaged in. Also, the number of times that the behavior occurs, that is their frequency, and the duration of each behavior can then be recorded if that is a variable of interest. For this purpose, for the purpose of structured observations, target behaviors must be clearly defined beforehand, and in such way, different observers can code them in with uniformity. In 1999, Levin and Horenzein used structured observations to study the differences in the pace of life across countries. And the measures they used were of observation of pedestrians in large cities to see how long it took them to walk 60 feet. They found that people in some countries walked reliably faster than people in other countries. For example, people in Canada and Sweden covered 60 feet in just 30 seconds on average, while people in Brazil and Romania took close to 17 seconds. The advantages of observations include direct access to the research phenomena, high levels of flexibility in terms of application, and a generation of a permanent record of the phenomena which can then be referred to. Observations do have disadvantages. Ethical concerns of informed consent and the use of deception is a concern. Longer time requirements is a cost. High levels of observer bias could be resulting due to the observer influencing the results. There is lack of control on extraneous variables, thus affecting inferences, and Hawthorne effect could interfere with the results, and ecological validity, how well those results could be applied to the real life settings is questionable. Moving on to case studies. Case studies are an in-depth, often longitudinal examination of either an individual or social units, a group of individuals. It involves detailed description and analysis, and most often researchers would conduct case studies on rare or unusual conditions or disorders, or in individuals who have undergone brain damage in specific areas of their brain. Depending on the focus of the case studies, individual may or may not be observed in their natural setting. It could then be in a therapist's office or a lab or hospital. Case studies tend to be more qualitative and they provide in-depth descriptions rather than statistical findings. Some quantitative data may also be included in the write-up of the case study. There could be various methods that case studies could be using. These include things like interviews, naturalistic observations, structural observations, psychological testing, physiological measures, and several other varied tools. A prominent example of a case study in neuroscience is that of HM. HM suffered from severe epilepsy. His surgeon was able to localize his epilepsy to HM's medial temporal lobes and surgically remove large sections of his hippocampus in an attempt to treat his seizures. Although the treatment was a success, HM was now unable to form new memories. He suffered from anterograde amnesia, This finding gave neuroscientists the information of how short-term memory and long-term memory were localized in the brain and that they did not originate from the same brain region. Freud studied Anna O and gave a lot of insight into depression, hysteria, anxiety, and other psychological conditions. Watson and Rayner studied little Albert, although what is now considered an unethical study. This gave broad insights into the fear conditioning of individuals, and in this case, an infant. Questionnaires are used as a very important research tool, a widely popular tool, and which will consist of a series of questions with the main aim of gathering information from respondents. They can be carried out face to face, telephonically, through a computer, or via post. Questionnaires provide a relatively cheap, quick, and efficient way of obtaining large amounts of information from large amounts of people. It can measure things such as behaviors, attitudes, preferences, opinions, and intentions. Questionnaires can have both open-ended and closed-ended questions to collect data. However, the problem is of social desirability. Individuals may not be fully honest when they are responding to questions which they know will be read by somebody else. Close-ended questions are structured in a way that have pre-decided categories or predetermined responses. For example, yes or no. The data is nominal or categorical, wherein it could be dichotomous with just two options, male, for example, male or female, or it could be polytomous with quite a number of options, but yet they are predetermined. Closed questions can also have ordinal data. Examples include strongly agree, agree, neutral, disagree, strongly disagree, or unable to answer. Here are some advantages of closed questions, and they include the standardization of questions, wherein the same question can be asked in the same order, and thus replication is possible to test then for its reliability. Closed questions are more economical as the responses are limited. It will involve low costs in terms of time to analyze the data, and large sample size can become then representative of the population due to the feasibility of close-ended questions. Respondents will provide information which can be easily then converted into quantitative data in closed-ended questions. The disadvantages will be that they lack detail, and because the responses are fixed, there is little scope for respondents to supply answers which may reflect their true feelings. Open-ended questions now will gather more in-depth answers, and there may not be any preset answer options. The respondent is given the total freedom to construct their own answers and to respond in their own words. Complex questions can be asked here and can be answered in a more effective manner where more detail and more discussion can be pursued. Open questions were used by Kohlberg, which finally helped him to theorize about the stages of moral development. Open-ended questions provide rich qualitative data, and it allows respondents to elaborate and add new ideas as per their will. Researchers can then understand why a particular phenomenon occurs. The disadvantages include high time consumption and the suitability only for literate or highly educated respondents. Open questions cannot be used with large number of subjects. Let us now discuss some tips to creating quality questionnaires. Firstly, all questions asked must address the aims and objectives of the research. Typically, Each question should concentrate on one of the features of the construct being studied. The length of the questionnaire is important. It needs to be moderate, not too high, as that will decrease the chance of the questionnaire being completed in its entirety. Questions should be short, clear, and to the point, and any unnecessary questions or items should be. Pilot studies are an effective way to test the quality of your questionnaire. By administering it on a small group of people who will then give their honest feedback will enable the researcher to modulate, review, and refine their questionnaires to better suit the study's sample that will be studied in the future. Questions should progress logically from least sensitive to the most sensitive, from the factual to the behavioral and the cognitive, from more general to the more specific. The terminology used in questionnaires must be easy to understand and to the point. Researchers must minimize the use of technical jargon, and the language of the questionnaire should be appropriate to the vocabulary of the group of people being studied. For example, the vocabulary would be significantly different for in questionnaires that assess children's attitude versus questionnaires that assess adults' attitudes. Make sure that the questionnaire looks professional and include clear and concise instructions that the respondent needs to follow. One needs to be ethical while collecting information through questionnaires. The researcher must make sure to keep the data confidential and obtain informed consent prior to participation, and also be aware of their right to withdraw at any time without consequences.